Good morning, listeners, and welcome to Citizens Bulletin. Know your role as a Pennsylvania citizen. The show is brought to you by Americans for Prosperity. Our hosts for this morning are Emily Green and Larissa Gaughan. Emily, Larissa, good morning and welcome.
Good morning.
Good morning.
Before we get into our main topic today, could you each take a few moments to tell our listeners about your role at Americans for Prosperity and also about the work of Americans for Prosperity?
Sure. My name is Larissa Gaughan, and I am Director of Grassroots Operations for Americans for Prosperity Pennsylvania. So my job is to oversee all of the grassroots activity and the events that happen in the state. And, for that, I travel. So, 1 week I can be in Pittsburgh, the next Erie or Scranton or Philadelphia or at the Capitol. So I'm all over the place, and I work very closely with the field team and with our community engagement director, Emily, who's on the call right now. So I will let her explain her role with the organization.
Sure. Hi, everyone. So my name is Emily Green. Like Larissa said, I am the community engagement director for Western Pennsylvania. So I have the privilege of helping people break down barriers to opportunity all across the western side of the state.
Right. And so what Emily said was helping people break down barriers across the state. That is our network vision. Our network breaks down barriers that stand in the way of people realizing their potential. And this moves our society toward one of mutual benefit, where people succeed by helping others improve their lives. And I've said it before on other programs, but that is our North Star. We have that in mind for every event that we hold, every time we engage in a policy fight. That is something that guides us. Is it breaking down external barriers? Particularly, we try to break down those that are erected by government so people can realize their fullest potential. And, when we do these policy fights, we engage in a whole bunch of different, what we call priority initiatives, or places where we focus on getting good policy passed and, advancing those sort of freedom-based policies that will benefit Pennsylvanians. And so our different priority initiatives, what I like to call them, are issue buckets. So they are just issues that fall into a certain bucket. So we have criminal justice reform. That's an area where we focus. Another one is immigration. Yet another is foreign policy. And the one that most people are familiar with and something that has stayed with us for years now is economic opportunity. And one of those issues that fall into the priority initiative of economic opportunity is healthcare, and that's what we're going to talk about today, specifically nursing scope of practice. Now, Ashley was on the show, I believe it was in the fall, where she was with one of our policy analysts, Charlie Katibi, who works at our headquarters down in Arlington, Virginia, and they talked about nursing scope of practice and what this means. And, now our activists and our field offices are engaging more on this issue. So we wanted to bring this up again today and go over some of those basic points again and, what we're doing in our field offices, what we're hearing from activists and also members of the community. And as always, as we end the call, are ways that you can get involved. What are you seeing in your communities and how you can reach out to us. So going back to nursing scope of practice and the issue that we get involved in under the economic opportunity portfolio of healthcare is that we want Congress to improve patient choice and foster openness. And any reform should allow providers, medical providers, insurers, and entrepreneurs to bring transformative innovations to the market. That's something that we care deeply about, is innovation. So when we go back to our network vision that I brought up just a little bit ago about how we can transform society by breaking internal and external barriers that prevent people and Pennsylvanians from realizing their potential and enabling all people to improve their lives and fulfillment by helping others. This vision that we have is guided by 4 mutually reinforcing principles. So there are equal rights, mutual benefit, which I talked briefly about, self-actualization, and openness. And so I'm going to really dive into openness, where we said we want Congress to improve patient choice and foster openness. Well, what does that mean? Well, that means that, we want to allow nurses to practice to the fullest extent of their license. And, we don't have that in Pennsylvania, and that's why we are getting involved. And so just to, kind of piggyback on what Ashley talked about back in the fall, when we talk about nursing scope of practice, we're talking about advanced practice nurses who have advanced nursing degrees. So we're talking about nurse practitioners. And you say, okay, well, advanced nursing, what does that mean? Well, that means that nurse practitioners and nurses with advanced degrees have the ability to diagnose, treat patients, and prescribe medications to patients. And their license provides for them to do this independent of a physician's supervision. But we don't have that in Pennsylvania. So, in Pennsylvania, the way that the regulations are is that, it requires nurses to be under a doctor's supervision to get sign-off before practicing. And what does that do? Well, that just adds, another layer of, a barrier for people getting access to quality healthcare or healthcare in general. So we don't have that in Pennsylvania, and that's what we're fighting for. We don't have the ability for nurses to practice to the fullest extent of their license. So we are striving to be a part of 22 states and the District of Columbia in the United States that allow nurses to practice to the full extent of their license. And so, when we talk to members of the community, they say to us, well, this seems like common sense to us. What could possibly be the voice of opposition in this, right? And the biggest objection that I've heard and some people in the legislature have heard is that, people are saying that patient care will go down, or, it'll decrease in quality because, it doesn't have a doctor sign off, or, the people don't have an MD after their name. But this is just patently false. It's not true. And something that Charlie Katibi brought up before, and I think it's worth reiterating, is that over 115 studies have been conducted between 1996 and the present. And all of these studies have come to the same conclusion, and that's that there's no decrease in patient quality, or in the quality of healthcare for these patients. So, and these studies, of these 115 studies, some are from the University of Pennsylvania, from Penn, Duke. So these are high quality and reputable peer-reviewed studies. So going back to Penn, in one of these studies, Linda Aiken, who is Penn's nursing Center for Health Outcomes and Policy Research, she said that there's no evidence that physician supervision requirements lead to better patient outcomes. She said that, reduced practice, what we have here in Pennsylvania, actually reduces patient outcomes because it makes patient access to a primary care doctor more difficult, especially in rural areas, which we have a ton in Pennsylvania. So, we have this access to healthcare crisis in Pennsylvania, especially in rural communities, and she's right.
You know what, Larissa, to go off of that, 48 of all 67 counties in Pennsylvania are deemed rural based upon their population density. And the study that I was reading on PARuralHealth.org mentions that these nurse practitioners are more likely to work in these rural regions than any other form of healthcare provider. So right now, if they're not able to fully practice to the extent of their license, it's so clear that rural areas just aren't getting the health care that they deserve.
Right. And, it doesn't just involve, well, as horrible as it is for many Pennsylvanians who live in our rural communities to not have access to a primary care provider, this also expands into another area of healthcare, which is mental health care. And this is something that we're finding statewide. This doesn't matter if you're in an urban community or if you're in a suburban community or if you're in a rural community. So we have folks who have a mental health diagnosis, or maybe they haven't been diagnosed yet, but they have, let's say they have depression, they're having suicidal ideation, they're in the depths of despair, and they feel like they're going to harm themselves, they feel like life's not worth living. So they finally take that step to get the care that they need, to get in with a provider, and they call, and the office says, let's say it's around Christmas. Let's say, because it's pretty well known that the holidays it can be a triggering time for people with depression. So let's say that somebody is calling around Christmas time. They're like, I'm struggling with depression. I need to get in to see a provider, because I'm having these suicidal thoughts. So they do that, and then the receptionist says, well, we have an opening. We're scheduling out in March right now. We have an opening on March 31st. And so, you have people who are depressed. They're not able to function. They're not able to work because they're crippled by this despair and grief that they have, and they can't get care. So nurse practitioners, one of their focus areas that they can focus in is being a psychiatric nurse. So they can see patients. We have a lot in this area where there are nurse practitioners. They can see patients and they can prescribe medication so people can get the help they need. And, that's, again, that would go so far to sort of correct this mental health crisis that we have in communities too. So it's not just primary care, but like I said, it expands into, mental health care as well. So, with that being said, luckily there is some light at the end of the tunnel. We do have some legislation that was up, and, unfortunately this legislation started back in 2013, 2014, 2015, where we tried to get Pennsylvania to lower these restrictions so nurses could practice to the full extent of their license. And, it kept going through the Senate, but it just couldn't get through the House. So most recently, in the 2019-2020 legislative session, Senate Bill 25, which was sponsored by Camera Bartolotta, passed the Senate with almost unanimous passage.
44 to 6.
Yeah. So, outstanding here that, the overwhelming majority of state senators in the Commonwealth want to see this happen. And, it always got tied up in the House. So luckily, we have a champion on this issue, Representative Jesse Topper, who is from the center part of the state, about halfway between Harrisburg and Pittsburgh, and in the Blair County, Fulton County area. And he is the one who is sponsoring the House version of this bill, which is House Bill 100. And
I just wanted to add there, too. I think it's really important to note that on House Bill 100, there are 28 Republican co-sponsors and 21 Democratic co-sponsors on this. So there's widespread bipartisan support for this bill.
Oh, absolutely. Absolutely. And, I had an opportunity to talk to Representative Topper last week because he's the prime sponsor. And I said, I was just curious. as to why he decided to be the prime sponsor on this legislation. And he said that he got this call from a constituent who was talking about the access to healthcare crisis in his community and really brought it to his attention. And so the passage of House Bill 100 and getting it signed into law by the governor would help people in his community who are struggling and suffering right now. So this is something that won't only, impact his community, but it'll impact the entire Commonwealth and will give us greater access to care. So we did have an opportunity to talk with him last week. We had a roundtable discussion in the northeastern part of the state where we had some nurses come in, some politicians, and some concerned members of the community that, they were saying that, they know fabulous nurses and they were raving about their primary care providers who were nurse practitioners. And it would just be so great if we could expand this access to care by giving them the ability to practice to the full extent of their license, and how this would impact the Northeast portion of the Commonwealth. So this is all over. And, this isn't something that just has to be a primary care provider issue or a mental health care provider issue. This is also something that can be brought into acute care. So we could have set up in a rural community or suburban community or anywhere. We're all familiar now with the urgent care model, right? Where we can go in and, we have a cold or we have the flu or an ear infection, and we can go in and we can be seen, we can get medication. We don't have to get an office visit scheduled ahead of time with our primary care, if you're lucky enough to have a primary care provider. And, this would be a great opportunity to staff these sort of facilities with nurse practitioners who don't need to have the supervision of a physician after this bill is passed, because nurse practitioners, the scope of their license, like I said before, they can diagnose and treat and prescribe prescriptions within the scope of their license. So you have a child who is up all night screaming with ear pain because they have an ear infection, or that they have some sort of secondary infection from a cold they have, whether it's bronchitis or strep throat. You can go to this urgent care where you will have these nurse practitioners. You won't have that much of a wait time. You can see the nurse practitioner. They can diagnose, yes, your child has strep throat. Here are antibiotics. Here's a prescription for antibiotics. You can come back if the problem gets worse. It's just like how it is normally with a physician, but advanced practice nurses have the ability to do this. And so we want to grant this access to care for Pennsylvanians.
And I think it's important to note, too, that nurse practitioners, advanced practice nurse practitioners, want to practice to the fullest extent of their degree, of their license, because they've been training for years. When we're talking about SB 25 and HB 100, we're talking about the fact that there's still nurse practitioners still have to enter a collaborative agreement with a physician for 3 years or 36 hours. So they're still practicing with the physician, but after that time, they are able to practice independently. So there still is that relationship with the physician, but we need to allow them the ability to practice on their own. I've had the opportunity today, ironically, to speak with an activist in southwestern Pennsylvania, and she is a nurse practitioner, and she told me, all about her training. And she really emphasized the fact that nurse practitioners, when they're getting their degree, there's a heavy emphasis on prioritizing wellness and kind of this idea that you look at the individual as a whole. So when they're treating a patient, they're looking at the individual. They're noticing, both, the symptoms on paper, but they're also looking at what other situations are going on around the patient and how can they be creative and innovative when they're treating this patient. And because physicians are so busy and there's such long wait times, you can't get that care that you potentially could with a nurse practitioner. So I really think it's important to note that these nurse practitioners are very well equipped to treat the patient. They want to treat the individual as a whole. And she also noted that they are trained, nurse practitioners are trained to seek referrals when necessary. They're not afraid to seek referrals. If they're looking at an issue and they know that this might need to be referred to a primary care physician or a specialist, they are the first ones to do that. So really, if people are hesitant about this kind of change in legislation, there's really nothing to worry about because the patient's well-being will always be put first.
Absolutely. And if this is an issue that if you're listening to this program and what we've mentioned has applied to you, where you do not have a primary care provider or someone doesn't have a primary care provider, are you somebody who has maybe a mental health diagnosis and you've called to get an appointment and you were kind of turned away and told to come back later and, to kind of deal with your symptoms, until you could get in to see your provider? Do you have young children and, maybe they've been sick and you've called the pediatrician's office, they didn't have an opening and you had to wait an extra day for your child who was really sick to be seen and diagnosed with strep throat or bronchitis or, some other sort of medical diagnosis where this would have helped you. If this is an issue where you've been impacted, we would absolutely love to hear from you. Our Facebook page, you can reach us there, Americans for Prosperity Pennsylvania. You can comment on, we just had some events and we posted about this issue on our Facebook page. You can message us through the page and say, I am impacted. I need help contacting my legislator. I want to do some district office visits with you. I want to go to the Capitol and talk with legislators and lobby for this legislation with you. Or maybe you'd like to have an event where, we have a roundtable discussion with a group you're a part of. Maybe you're a part of a book club. Maybe you're a part of a mom's group or a dad's group that have been impacted by this particular situation. We would absolutely love to hear from you, and you can reach us. My name, again, is Larissa Gaughan. My email address is LGAUGHEN as a nurse at AFPHQ.org. You can reach me at any time. My phone number, 717-919-1838. We would just absolutely love to hear, what you're seeing in your communities. Emily, did you want to give your contact information?
Yes, absolutely. You can reach me at eGreene, EGREENE at AFPHQ.org or 412-552-0271. And before we, I know we're pressed for time, but I just wanted to leave you with a story of Dr. Mona Counts. She was a PhD and an APRN out of Greene County, and she was a trailblazer in the nursing industry. And fortunately enough, we were able to have her expertise in Pennsylvania. Dr. Mona Counts, she was seen as the grandmother of nurse practitioners, and she encouraged nurses in the industry to become APRNs and urged them to put others' wellnesses over everything. And she worked endlessly to improve healthcare in rural West Virginia and rural Pennsylvania. When she was living in West Virginia, she ran a clinic in her town, and when she was doing that, she found that so many people living in rural communities were either unable to travel or they were mistrusting of the healthcare in large cities. So she worked to bring comprehensive health care to her town and continued this when she arrived in Pennsylvania. And she started one of the country's first ever nurse practitioner-run rural practices right in Greene County. So we're so lucky to have that that trailblazer who was in Pennsylvania doing this great work. Sadly, she did pass away in April of last year. And every nurse practitioner that I've talked to in the region, when they talk about why they want to see this done, why they want to see this legislation passed, every single one of them mentions Dr. Mona Counts. So I thank you so much for your time, and I'll pass it over to Larissa.
Thank you so much. What a great story to end with. That's wonderful. Well, listeners, we are at the end of our time for Citizens Bulletin today. From Emily Green and Larissa Gahn, thank you so much for tuning in this week, and make it a great week.